Hey, everybody. Welcome back to the You're Not Broken podcast. I think I'm going to name this episode A Psychologist and an OB-GYN Walk into a Bar. Because today we have Dr. Kate White and Jay White, a married team who have separate jobs, but now they have one podcast that they do together. So welcome to the You're Not Broken podcast.
Thank you. Yes, we are heads and tails. Obviously, he's the head, and I spend a lot of time at the tail.
Correct.
And we
So cute.
saw so much overlap in our patients when we would come home and talk about what was going on in their lives, especially in midlife, where we were seeing the disruption of relationships, not just their relationships to their partner, but also to their job and their parents and their families, even their friends during midlife. And the more we talked about it and the more that Jay saw what I was going through myself, I think it all kind of coalesced into we're talking about the same problems from a different perspective, the biology and the psychology and how they interact.
I love it.
Great.
That's why the marriage works.
Yeah, you heard like, since we talk about this all the time, we should just be recording.
Yes, exactly.
Yeah. I love it. Well, I'm so glad you started your podcast. And, a lot of midlife, I was just on NPR for the second time. And like, the zeitgeist is like, why does midlife have to happen? Isn't it all shitty afterwards? Like, the cultural attitude of this, frankly, sucks right now. And I was like, this is like an amazing, and I never want to be Pollyanna, but I'm like, it's an amazing opportunity that like a lot of good comes from. But, it's like any spiritual journey, like the pain is part of the recipe. But it was just like, okay, they're asking on NPR, like, why the hell does this even have to happen? So is that what you're hearing from people? Like they're coming in and they're like, why do we have to get older? Why do we have to grow spiritually and psychologically? Like, how's the attitude on this on your end?
Well, with my end, yeah, it is. I run into what I like to refer to as the side effects of success. It is, we're lucky that we live long enough, and there's not many animals on Earth that live past a reproductive age. I mean, if we want to just, put a pin at a point in time, and yeah, and also the success of managing kind of getting older and managing perimenopause, menopause symptoms, and so forth. I run into this, and at first, I've said this on our podcast. At first, I didn't know what it was. I didn't know what it was either. It had a lot of people mid 40s and above kind of struggling with the same thing. And finally, when I put it together, I feel bad that I missed it for a number of years. I mean, but
because you didn't get it, and to back up just so people understand what your training was, you didn't get trained in like the rubber might hit the road at around 47.
Right. And then once it's like I don't know, it's like a movie where the last scene explains everything that's happened in the movie. Oh my gosh, he's been dead the whole time. That kind of thing. That's the energy I felt once Kate really got into, the sort of menopausal care and midlife care. But when you reframe it for people, which is what I'm doing a lot, it makes a big difference. I mean, when you tell people, hey, we used to all die at 40.
Right. That's a fact. Even if we are, because they'll argue that. They'll be like, it was all infant mortality. And when you took infant mortality out of it, you actually lived till, and I'm like, no, even the people who look at longevity factored that in, my friend. Like and I put in my book, the wealthiest male landowners in what is now Britain, because those are the only people you're going to waste some ink and a piece of parchment on. The wealthy male landowners who didn't die in childbirth, average age 47.
That's crazy. That is crazy.
The healthiest people in
the wealthiest,
world.
Healthiest, with no more death in childbirth. They had the money, they had the land, they had the food. 47 was it, my friends. And the other thing, going into marriage and why does it get rocky and what do we do and why is it so challenging? Because we get a little like whingy about it, to use a British term. We get kind of whiny about this consequences of our success. I heard that up until very recently, an average marriage lasted 7 years before somebody died. I haven't checked that fact in a while, but it's like she either died in childbirth, he went off to war, right? Like just somebody got a bacterial infection and there wasn't any
Right, and then
antibiotics,
they're done.
right?
Right.
Like the average marriage lasted 7 years until one of the two people died. I'm
There you
sure
go.
there was
Wow.
the
That
outliers,
takes care of the 7-year itch. You're like, it's just like the itch might be the plague.
right? Yeah. But yeah, that's the other thing of like the consequences of like, oh my God, we've got 60-year marriages now.
Mhm.
Mhm.
Right. Right.
And I feel like that when we have these transformations, because you have the hormonal transformations that change what's going on in your brain. We look at that changes in estrogen, which inform the dopamine, the serotonin, the norepinephrine, epinephrine, all those things. We are going through a time of becoming that's very dramatic, akin only to puberty. And if you had to try to get married at 14 or 15, which some people did, and you're in the midst of all this change and come out the other side and say, is this the person I want to be with? You may not find the same desires or you're not going to be the same person that you were. Your desires at 13 are not the same as your desires at 18. And just the very same, your desires at 30 may be different than your desires at 60. And so this gray divorce is a lot of what we would see and the
Mhm.
struggles. And there are a lot of people though that say, things are changing my brain. I'm not from the female side. Things are changing my brain sexually, of course, and then also in anxiety, depression, all those things where we see 30 to 40% increase across the board. ADD, which is where I had a tremendous change in the ADD increases if you don't have ADD symptoms before your menopause. You have about a 30% increase in changes in executive functioning, which people struggle with.
If you
And
have ADD,
yeah, someone here does. It's about 70% increase in the level of distractibility, difficulty with organization, and all those executive functioning skills. And if you are the one who's been managing the chaos of life, which most of us have been, and doing pretty good job at it and trying to keep everyone on track and that goes away and you feel like, hey, why am I the only one doing all this? Then that can cause explosive changes. So, and I think what you hear a lot is, I haven't changed
right? That's what the
from the,
man. Yeah,
That's
because
what the man says.
that's
I'm
what the
the
man
same
says.
guy as I was when I was 20 when we met.
Exactly. I'm the same. What happened? And I'll tell you another part of what I was saying with the side effects of success. You folks like yourself have been, man, the tip of the spear for fighting again for testosterone, for thank goodness the hormone replacement therapy is back in the sunshine, and it has been so successful and so moving that I get a lot of guys that now, and this is a problem with couples, they look at menopause as something that's a phase. They look at it as temporary, and I mean, seriously, they'll come
Like,
in. I had
just
one guy
buckle
ask.
down and this too will pass.
Yeah.
Okay.
And I had a guy say, all right, send her to such and such. And how long till I get my wife back? I mean, it's like sending a car to a repair shop or something. It's like, and that's the way he put it. He says, was it like a month or something? And then she's back to, whoa, man. I mean, as if it's just a phase and a bump in the road. And man, this is forever. This is, I like to call it the director's cut of your wife, but it's something like that. And there are going to be changes that are just some that are manageable, some that are permanent, some that are better, and just buckle up.
Yep. I think there's the social stigma that staying the same is the better thing though. Changing because you're changing, that's the problem.
Right.
Like there's a societal layer of judgment that benefits the status quo as the guy's the right one because he isn't changing.
Right.
You know what I'm saying? Like, are you seeing that of like, we prefer stasis, please.
I do see that, and I
well,
want to
it's
hear your thought.
predictability. And so you it's like, it's the devil, it's the known. And when we look at longevity, we think of like, I'm staying exactly the same as I was when I was 50 until I'm 104. And so that stasis of not losing, not, you don't want to lose muscle, you don't want to lose bone. That stasis is sort of in our brain as everything's good right now. Let's keep it the same. But it's not really what serves people,
It
really.
is weird. Yeah, you're right. And that's a great question, Kelly, because it's every other phase where we change, and there's a bunch, obviously, from birth until 18. Um, Everyone makes us better. Every single change makes us, all in all, a better human being. And to suddenly say we need to stop, I don't get that.
It's
I mean,
weird when
there's
you look
some
at it,
parts of
right?
my dad. I mean, my dad's 84, and he just says, I wouldn't go back. I'm telling you, I like where I am now. I like the way I think. I like the way I don't like the way I groan when I get up in the morning. But I mean, yeah, look, there's gonna be give and take. But yeah, to
Well,
think that we need to stay the
I
same.
don't like the acne I had when I was 13. So
Correct.
like
Yeah,
you
yeah,
want to move
yeah.
on to
Right,
things.
right.
So you have some progress.
I
Hopefully.
miss my hair.
I don't actually.
Okay,
I like
thank you, baby.
I like you hair free. Oh, yeah, actually, but that's just personal preference.
Yeah. But I think it's a extra societal burden of, like, not celebrating the change. Like, you're a
Right,
fully formed you know you got the right to vote at 18. Like, why do
right,
you gotta change after that? Right?
right.
Like, there's this, like, societal status, and if you look at other cultures, older cultures, previous cultures, where the old people were the wise counsel,
Hmm.
and you didn't earn that until you got to that place, right? And here we are in our society being like, "Why are you changing?" You know, you're like, you're missing what historically is like, it's the wise person. It's the, the person who's got the experience. Like, there's this like reverence of having life's journey. And now
Hmm.
we're like, why is my wife changing? Why, or the woman will say, why can't he change?
Right. It will. It's funny. And if we take the social, sort of the cultural, I don't know, you take the normal timeline, if you will, and you I don't like the phrase, but the men get softer and women get harder. Men a lot of times also at this age will libido is down just a little bit. They have fought all their battles. They've slayed the dragons they've worked. They're tired of the fighting and they become, and I can see why women say, "Why are they not still? Why are they not changing?" They turn into a, I want to golf, I want to nap, I want to. I'm not everybody. I mean, I want to travel, and they really kind of, I don't know. Their lives become simpler, and it would be a lot easier if, wow, if she would slow down also, or she would not change, or she would stay. Cost
She would
and
be another thing that became easier.
yeah, if she would become, and it doesn't, and then kind of I wouldn't say the opposite happens, but certainly you've got to be ready to adjust and to pivot, and a lot of guys just don't. They don't want to, and again, that's a lot of reframing that you have to do in counseling.
Hmm. Yeah, it's fascinating. Well, I think, and then to take the stereotype to the female, like she's taking care of all the other people.
Mm,
She raised the baby, she organized their life. Maybe she
mm,
put her education on pause. Like, and she gets to midlife and she's like, "I'm gonna start a business. I'm gonna go do this different
right,
career. I'm gonna go
correct.
double down on whatever." And you're like, she's changing.
And so much of it is taken for granted also that you have, man, if you take just our Christmas presents, Kate buys presents for everybody, for my parents, for him, and I have to buy her presents, which I buy with her. We have a shopping day, and then I buy one thing for each kid, and it'll be a T-shirt that's like "Dad's cooler than mom" or something, and it'll just be something ridiculous that I don't know. I mean, it's just kind of automatic, and they're opening their presents on Christmas morning. I can't wait to see what they got. And so much of it is we've often, as guys, we will. Man, I see so many guys pat themselves on the back where I cook twice a week. That's fantastic. I mean, But it's yeah, when the change comes, man, they don't like it simply because even if it just means they have to do more, and she's still off conquering the world. And yeah, exactly like you say, what if I want to change jobs? What if I want to visit my friends more? What if I want to, yeah, I mean, it's,
The conversation. It's always trying to meet that, like, get back to the where who you want to be together.
yeah,
Because that you are one entity at some point,
right.
and you say, if you're like this, that doesn't work. So trying to keep that communication, and when we're, Kelly, I'm all over the place doing new things at this point where he was like, what? And we've really had to have those conversations, which I think has been valuable for your counseling too, because it really has informed how he addresses couples in this time where the woman is
Yeah.
like, I'm becoming someone completely different. And you can be okay with that. And
I'm
or
just I'm thinking of it when you say, what would you say to a couple who, and then she just explains her life. And then, wait a minute. It's just us.
yeah, so-
Is this person married to Jay, hypothetically?
that's right.
Yeah.
But trying to bring people in. And I think that women have a lot more opportunities to discuss these things with just by, I think in general, the nature of women is more to talk through things than it is for men. And maybe even to have better social support in general than men. And so if they suddenly find themselves in a situation where the person that they have been mostly relying on is a person who no longer is on the same page with them, that can be a really difficult problem for men. And I think that's a lot of what we've talked about that
Mhm.
you've did, is that men without social support other than in their relationship can be a real problem. And so when women say, I'm done with you, what you're doing here, then the man is like, what do I do now?
I'm alone.
They ignore it, or they think it's going to go away.
Mm.
They think they're just going to go back to work and go back to doing the things they are. And then the same person, they come home to the same person who, with the same dissatisfaction, they don't have a language to even speak to each other about it. And they don't have a social support where they can go out, where we can be like, I'll see you. I have a group called
My
Game
third book club of the month.
Book
Yeah,
club.
game,
Club, or
game gals. And so,
I have a thing called happy hour.
well, so they
No,
do
it
have
is
a
good.
happy
It's
hour,
a
and
good group.
but it's not really about, it's really more a social
It
hour.
is. I mean,
And
yeah,
that's having some sort, but a lot of men don't have that.
right.
And so that's when a counselor really, really becomes valuable to,
Mhm.
and a lot of couples really need that a little bit of a push to be like, and I talk to patients about that a lot. I was like, hey, I think that maybe you guys need to have some talk to a counselor, through some of these things, because I've never seen you this angry. And they'll come in, and I'll actually have patients come in for their pap smear, and they'll come in and they are just enraged after about a few minutes. I'm like, so tell me what's been going on. And I've known these women for 20 years, some of them, and they'll be like, oh my gosh, I'm just done. I'm just done. And that is, they just can't, they keep going back and saying, this needs to change, this needs to change, but they don't have a way, but they're getting no response, or
Mm.
they don't have the language to communicate their needs. And so
Mhm.
they need a translator, really, is what I feel like in some ways. So what are your, I know you're talking about
I
where you
agree.
would, thank you. See, it just is why it works. But I think you've talked about how you can be like, a good counselor isn't there taking you inside, but it's
Yeah.
just,
Right. The goal is to never have a couple think that you're on one of their side, somebody's side. Yeah. An easiest way is just, I will find myself all day, every day saying, I'll say something like, it'll go just like this. I'll say, I'm not saying she's right, but when you say this, here's what she's hearing. And and she's just over there nodding, or you do it vice versa, and it is, at least you get them on the same sheet of music. So then
I
you
mean, yeah,
can,
this is not the first time I've heard. I've had other men on the podcast before who've said, like, men aren't listening. Like, they have trouble listening. Or women are like, I told him 10 times and he said, yes, yes, I will do blah, blah, blah. And then he doesn't. Like, is this like a neurological way the brain is built? Or what is it? Like, to me, I'm like, explain this to me. Because it's not the first time I've heard this. I'm like, he is not listening. Can he not listen? What is
yeah.
it?
No, so you're talking about, so you may have to give me an example, but you're talking about, they're asking something fairly simple, and then he is unable to do it, or he is not, well, is he, oh, here comes our weather report. Sorry.
It's all good. It's
Now,
gonna
now
be
everybody
cold.
knows the weather in Mount Pleasant, South Carolina.
But yeah, it's like she's like, "This is pretty simple." Like, multiple examples come to mind. One is like, I told him I don't like him to just walk up to me in the kitchen and grab my breasts, but he keeps doing that. It's like, that would be a simple, "I've asked you to stop, you aren't." I told him that I need him to help out more around the house. I gave him concrete
Mhm,
examples, and he doesn't.
mhm.
Right?
Right.
And then, like, they'll go to the therapist or the coach or the divorce
Yeah.
attorney or something, and he's like
Yeah.
she's
I
like,
got
"I
you.
told him multiple times." And he's like, "Ah."
Right. Yeah.
Right? So,
Yeah. Yeah. Yeah.
like, I have to think the stereotype exists for a reason.
Oh, yeah, yeah, yeah. Well, okay. So two things come to mind. I will ask a lot of couple, and this is fun. I will ask. Well, I'll get a couple, and then I will see them individually. And usually, when I'm with the guy, I will give him this scenario. I'll say, "All right, a mysterious stranger comes up to you Monday at noon with a satchel, opens it up. Inside is $10,000 cash. He closes it up and he says, I will give you this money next Monday at noon. So 1 week. And if the condition is your wife has not gotten mad at you, has not barked at you, has not snapped, has not gotten angry with you this whole week. Two rules. One, you can't go home and tell her, hey, we get 10 grand if you don't get mad at me. And number two, you can't just go out of town, right? And not see her for the week. So when I ask guys this, and I asked the whole group of my friends, this was fun. There was about 10 of us there that day. It was a big crowd. And they hit the number, man. About half of guys, 50%, and it's terrible that it's only 50%, but 50% will say, they'll start coming up with the ideas. They'll start saying, oh, wow, I think I'd help around the kitchen more. I think I'd bathe the kids. I think I wouldn't play golf that week. And again, it's not that she gets mad every time I play golf. But that can make her mad. You follow me? I mean, so they kind of know. I don't think I'll go up and grab her boobs in the kitchen. They know. All right. Then there's about 40% that won't change anything. So they'll say, and their argument is, and this takes a lot of unpacking. These are the toughest ones in counseling, but they'll say something like, if I tried everything I know how to do, there'd be a 25% chance she'd get angry with me that week. If I just live my life, there's a 30% chance. So you see what I'm saying? So the juice isn't worth the squeeze. And then about 10% say, my buddy Matt, he says, I could go home and tell her tonight that we get 10 grand, and she'd yell at me about that. I mean, so they just argue all
Yeah.
the time. It's kind of how they communicate. So to me, it's funny if I get the person that is one of the 50% that kind of starts naming things. This is what I would do more of. This is what I would do less of. They know. So they know. So if they are choosing to grab her or to not take out the garbage or to something like that, they're just being either stubborn or lazy. And so that takes a certain type of counseling. If they just kind of shrug their shoulders and say, it's anybody's guess, like they're walking through some minefield or whatever. Well, then it's, okay. All right. Now, is it really, you have no idea and then the 10%, they're just fun. Now, what's funny is when I get the wife back in there. And you can ask this question if to the wife about the guy, if he is one that is more likely to to start an argument. It's usually the other way around, and this is because it's well deserved, that guys are getting barked at. But if you then bring in the wife or the girlfriend and you say, I asked him this question, the first thing they want to know is, what do you say? They always want to know but the second thing is they always think it would be easy. They always think, my gosh, all he has to do is that I've told him, and so there is, for whatever reason, this disconnect, and it's fun once you get him in counseling. She says, how many times have I told you not to grab it? I mean, to use your example, not to grab at me when I'm in the kitchen, especially when the kids are around. And he'll look at the floor and shuffle his feet. I don't know. Yes, you do. Yes. And until someone else hears it, or until there is a reason to stop, or accountability, or something like that. But it's terrible. I hate it when it eats away and it just becomes this cancer. And guys have refused to change, either in helping or doing less of something. And now it becomes poisonous. And,
Yeah, I mean, I'm like, it's the wrong word, hell hath, but I just like, hell hath no fury like a woman who's fucking done.
right.
Like, if she's
Oh, man.
fucking done, game
Yeah.
over.
Yeah.
Right.
The relationship's over.
The
Yeah.
relationship's over.
And people ask me that, people will say, well, how many marriages do you save? Or do and I always give them the same answer. It's if they are still in love, then it's almost all of them. I mean, it's 95% rate. If it's she's in love and he's an idiot, it's most of them. But if she's done, I mean, once apathy sets in a woman, and yeah, there's your 5%. There's your,
Totally.
uh,
And usually she gave years of warning,
Yes.
right? Like, this is
right.
not like, I don't know, it's just the weirdest thing on Tuesday. She was done. Like, no.
Well, listen, that is how it can be. I mean, sometimes guys will come in and say that, and it'll, and why did you come to therapy? Well, she said she was done, and this time I think she means it. Okay. That's when you decided to come in,
Yeah. Yeah. Watch out for the done. Do you think the statistics are true? 'Cause I mean, we could Google it, but it's like 70% of divorces are initiated by a woman. If the woman has an education, 90% are initiated by the woman. Is it that high?
Yeah, it's up. Yeah, it's close to
I would
that.
say
Yeah,
that's
yeah.
probably what you
That's
see.
right. It's more than the 70%. I don't know if it hits 90, but it's close. And I think there is a point at which the woman has just said, I'm all right. This has to change now, or I'm done. I mean, I would rather just be by myself and with my girlfriends, and travel. And the kids are grown, college is paid for, or what, it's, there's a whole lot. You have to really be a partnership, or,
Yeah.
yeah. And that doesn't surprise me. And I don't think it's right you'll hear that used as a weapon online, in some of these interviews. Well, so 90% of women are, well, but they're not coming to that. They're not doing that at just a roll of the dice. I mean, as if it's just luck that somebody asked for a divorce. I mean, you have not been listening for a long time.
You haven't been listening for a long time. Yeah. What advice would you say as far as staying connected? Dare I ask, how do you stay in love? What are the tips and tricks of like, do these moves and like they're helpful moves to stay in partnership? What thoughts would you have for people?
My favorite metaphor or analogy, my mom's an English teacher and so is my wife. I should know the difference of those two things. But I think it's metaphor, but my best friend Ken came up with this, and what he does in premarital counseling, I use in marital counseling, and that is, and it's a sports analogy, so I apologize up front, but he said, when you point to the guy and you say, when you grew up with your two sisters and your mom and dad and dog, you your family wore a red jersey, and then and I'll ask their favorite colors or whatever, and then she'll makes memory. So then I'll say, okay, you and your sister and your mom wore a blue jersey. Now, when you get married, or now that you are married and have kids and so forth, you have to pick a brand new color. So that is your color. So it can be purple, it can be yellow, whatever it is. And you can take your old jersey and frame it and put it on the wall, right? You can have the blue jersey sitting up, but you cannot take it out of the case and put it on when you get mad, right? This is the family and this is your team now. And because I'll hear it, man, it's so funny how people have been married for years and they'll use the phrase without thinking about it. They'll use the phrase, he just doesn't get along with my family. Your family is him. And so it's they don't get it. That's my husband. This is my family that lives over. And he's like, so you have to make that. And that's something that I think we did well. We did well. And
Our
some
jerseys were pink.
anyway, so in my fierce pink jersey, but when you do that, and so if it's you, and not against the kids, but if the kids are trying to get between you, maybe mom will give me permission, maybe dad will give me. No. When they see you both wearing pink jersey, um, they get it. They understand. And when people outside of when your mother-in-law comes over and says, "This is the way I do it," and you say, "Whoa, whoa, that's not the way my wife does it." That's it. You know, if you can do that, it's a powerful thing. And so and again, you can use whatever kind of visual you
And
want, but
so
that's
just
the word.
maintaining the connection
Mhm,
through and thinking of
mhm,
yourselves as a more of a unit. And when one person is pulling away, that's where it's hard. I mean, but
mhm,
the communication, finding that shared time, I think
mhm,
is very important, but also the appreciation. I think that a lot of women, especially, probably feel underappreciated, but a lot of men do too. And when we look at, I know we're not really probably have time to even talk about sexual function and how sexual intimacy, but intimacy, whether it's intimacy is probably the cornerstone to relationships. Whether it's
mhm.
not necessarily the sexual intimacy, but when you're talking about it yourselves as a team, that's an intimate relationship. And trying to maintain that intimacy may or may not involve tip what we think of as traditional sexual touching or sexual interaction, but it is the intimacy that if you lose that connection, that is
Right.
going to be a
Mhm,
big detriment to the relationship. And I think that and when it's the loss of intimacy may even be the loss of the affirmations that you get from your partner and the reinforcement of your worth. All those things are part of intimacy, I think. And
yeah.
so that's where when you start losing that, then the team falls apart. And I
Yeah.
think that's true. I don't know how we got on this extended sports analogy, but no, if you don't have a cohesive team, if you don't have communication and you don't have that, you don't feel the need to propel each other together
Mhm.
forward. It starts falling apart.
It
And
starts
so,
getting like my way or the highway.
right.
Right.
Instead of like, we're a team, what does the team need? How can
Mhm,
I support my teammate?
Mhm.
mhm,
Like a more of a we conversation. I think this,
mhm,
like, people should know this. Like, one person needs sex to feel intimate and close with somebody, and the other person needs to feel intimate and close with somebody in order to have sex.
yeah,
And
yeah,
those
yeah.
two people are living in the same house and they have no idea.
Right.
Mhm.
That's perfectly put. Yep.
Absolutely.
And it is, and you can see how when it's going well, it's a circle. I mean, they're both getting that, and it
Mhm.
doesn't matter where it
Yeah, you
started.
don't have to think about why it's working. It's just working.
It's just
Mhm.
working.
It's
And
just
when it's
working.
not working, it's so you have to, I don't know, prime the pump, or you got to get the engine running again.
Yeah.
And it
Well,
is,
I want your two perspective on it because I've been a urologist for a while now, and when there's one person in my office they blame the other person as the
Uh-huh.
reason for why they're not having sex. Universally. Doesn't matter the gender. The woman says, we're not having sex because he has erectile dysfunction. He says, we're not having sex because she doesn't have desire for sex. They're always blaming the person who isn't in the room as the reason why the unit doesn't have sex. Please take that and discuss.
Go.
So I think that when I hypoactive sexual desire disorder, we know probably we would look at statistics about 1 in 10 women complain of hypoactive sexual desire
And that's
disorder.
hypo.
Hypo meaning
Less.
low desire
Right.
that is disturbing
Because when
to
you, the first time you said that, I pictured hyper in my head.
Yes.
And I was, whoa, that
You get into that.
sounds great.
Sounds great.
No.
But hypoactive sexual desire disorder, which is something that is and it's distressing to you, where you're like, I actually just want to have sex. I think it would be valuable for my relationship, for our closeness, but it's coming. It's just not there. And people, whether you want to call it decreased libido, that's probably the common name for it. And it impacts how they feel about themselves, how the woman feels, a lot of guilt that goes along with that for women a lot of times. And if you get to that point where your brain no longer produces that desire sensation, which is just a mood that's biochemically created in your head, then you have to, it can cause a lot of distress in the relationship. And so I think part of it is you can get it at different times. I'm sure I've seen it a lot postpartum, where I think is maybe a biologically protective to try to keep you from reproducing when you already have another small person in the cave.
Yep.
And then it gradually does really typically come back within about a year and a half. I'm like, it's going to get better. It's okay. But when we go through that again in menopause with hormone changes in the brain, or just when you're busy, stressed, anxiety, depression, acting on that desire center, which people feel like that it shouldn't be. We don't like to break everything down just to neurochemistry because that's not very romantic. But I'll talk to people and I'll say, have you ever been on a keto diet or sugar busters? Nor this, or sugar busters or anything like that. In the first couple of weeks that you're on it, you're like, oh my gosh, I would kill for a Snickers. And then after a while, you think about, Oreos actually, those sound disgusting to me. And you think about sex and how if you're tired or have anxiety and or ADD, which happens in midlife, that all of those things shut down your desire center where I'd rather just sleep. My brain is going around and around and around of all the things I have to do. So it really takes either a medical refocus or a concerted effort to refocus your brain to get that desire center back online. And I know for just women with AD, and I don't know if I really don't see this talked about very much, but in order to have an orgasm, you really have to almost shut down your frontal lobe.
Yep, that's true.
And for women who have ADD, and it gets 70% worse with the hormone changes of midlife, you can almost not shut it down. So orgasm gets harder, and then you're really just doing marriage maintenance sex is what we call it, where it's just, okay, it's been about 2 weeks. We should probably just go ahead and do it because I know that things will start to get weird if we don't. And so to be able to talk that through and to be able to say to my partner, in my case, I'll just talk about me, say, you know what? This is too much information. I'm just going to say it.
Here we go.
I'm like, I have to have sex first thing in the morning when I have nothing on my mind, because otherwise I can't even begin to start to have anything can focus. And so when I talk to patients.
So every morning I wake up at 5 and I just wait.
I'm showered. I'm caffeinated.
Hey, you don't have
I've got my pink jersey on.
But it is. But I think when you talk to women, and you say you're not alone in this. This is actually normal, and we can work on things like sensate focus,
Mhm.
and you can talk to your partner about need, not foreplay. We need to think of this as sex. I need the sensations. I need
Right.
to be able to focus my brain.
I need time to get into my body.
Yes.
That's
Yes.
good. And I see, of course, I hear this all the time, and it will be a focus on as a couple will be how much communication, but how much we consider intimacy. I will say intimacy is everything
Mm.
from talking in the kitchen to holding hands to watching a movie together to say, so, and people often use intimacy as synonymous with sex, and that's not it at all. And I will, yeah, I will get what you get where people are blaming the person that's not in the room. I get it where they're blaming them right there in the room. But is funny if a lot of times one of the best things that you can get from counseling is to take the pressure off.
Mm.
So to give yourself, and again, to make it so that, all right, what time of day or when intimacy or when are we going to talk about or when are we going to be a team or what? This just gives your body the chance to relax and mind the chance to relax. And I'll give you an example. I will often sort of prescribe, if you will. I will say, we're not going to have sex this week. The two of you, I'm talking to a couple, the two of you are not going to have sex this week. Now you can do whatever you want. You can obviously sleep together, you can shower together, you can hang out together, you can hold hands, you can do whatever. But there's let's take sex off the table this week. And you can't believe how often they come back and they said, "Oh, we had sex all week," or something. Where and not every time, but it always makes things better in that, man, I'm not going to, not only are we're not going to have the pressure. I'm not going to feel bad about this. I'm not going to have to perform if there's erectile dysfunction or something like that. It's man, and the closeness, you'll see it. You'll visibly see it. They'll sit closer the next week. I mean, it's great. And so with enough of that, you kind of rebuild or at least set up the groundwork for rebuilding
So the
and yeah,
goal isn't more sex, it's less pressure and more safety to let that
yeah,
desire come
and
out.
just more
Yeah.
intimacy.
Yeah.
Intimacy meaning again everything that involves closeness.
Yeah. I think the other thing that's super interesting is what does sex mean to you? Because you're like, "Oh, I've been living with this person for 20 years and I didn't know what sex meant to them." Like, that's enlightening. And just think it offers a lot more compassion to like, he just wants sex. He just wants an orgasm. He just wants to use my body for pleasure, blah, blah, blah. Like, no, no, no. Sex means love to him and that you're the special one that you get to have sex with him. And like, people don't know what sex means to people. And I want to flip the hypoactive sexual desire disorder conversation because we always talk about if it's bothersome, if it's distressing. We're not talking about, I am not interested in sex anymore. Sex is gray to me, but I'm not bothered by it. I could take it or leave it,
Mm,
Mhm.
but it's distressing to the partner.
Right.
That, right? Like we don't have hypoactive sexual desire disorder not bothered, right? But
Right, right.
to the partnership, that is a bother because we started out having sex. And I think this is what nobody wants to have this conversation. We started
Mhm.
mm,
out having sex. Now, I'm going to stereotype, but this is
mm.
any gender can be any of these roles.
Sure, 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 sure.
But she could take it or leave it. And
Right.
he's not okay with that, but he's supposed to be okay with that. And he's like, but I'm not. That's
Yeah,
not what
yeah,
this
yeah, yeah.
relationship was. And I'm like, we need to validate both people in that relationship.
And sex is on an island when it comes to, if somebody were to say, my wife and I used to play golf twice a week, and we did that for years, and she's no longer interested in golf. So now I go play golf with a couple of buddies of mine a couple times a week. You can substitute any word for golf except sex. And you can, I go have sex with a couple of buddies
We
twice a
had
week.
pizza. We had pizza twice a week.
Yeah.
Anything except that. So it is, yeah. So it is its own, you know, special animal.
And of course, you have to look at the changes that I also, when I try to go through these in the office, I'll say, okay, let's start with making sure there's no pain.
Yes.
Is there
Right.
a physiologic reason that you stopped having? And some people don't even realize that's why they stopped. They're like, oh, I started getting a little dryness. And a lot of times when people come in, they say, not really having any problems, just a little dryness. And like, that is a change in your vagina and your vulva and your clitoris and all those areas that we need to address, because your brain is never going to, that desire center is never going to activate if it's like, well, if I don't have this, I don't have pain. You
Yeah.
know, that is like, so
100%.
that, and so
Like, it
start with
sounds
the,
like a no-brainer, but maybe it's only because we've been well trained in that
right,
of like, I
right.
can't make you like hitting your thumb with a hammer. Can't do it.
Right. It's
Can't be
it's
done.
amazing where there's this like, oh, just a little. So look at the physical, and then we look at, are you still able to have arousal in women? We think about it in men, it's pretty obvious because they're either, aroused, they're either got a boner or they don't. But with women, it's really hard to say, because we're not taught to look for arousal in women. Is that a problem for women? That's a new thing. And then we look at desire. So I think that if we have to go stepwise through these things, and maybe the desire or lack of desire is coming from these other two problems that we haven't addressed. And then there's all kinds of things that change in midlife. Lots of health things that impact us. Medications we maybe started taking, as we know, SSRIs, as the medications for anxiety and depression, which are some of the first things that are prescribed for the anxiety and depression that you get in menopause with the hormone changes. Sleep apnea, with the weight gain that you can get and changes, sleep apnea, sleep disruption, how that impacts our sexual function. So trying to go through some of these things, and we try to give people a framework. And like we've talked about this, of things that they can go through, look at the medical things and also look at the relationship things. Look at the pain, look at the desire, arousal, pain, look at the medications. Is it a blood pressure problem? Is the with the erectile dysfunction, you see that all the time with blood pressure medicines, right?
Yep.
But why do we never talk about that for women?
Well, it's the exact same thing. That's the thing. It's like
Exactly.
arousal is blood flow, right? And like, why would only one gender have blood flow to the pelvis for pleasurable sex, right? Everybody has blood flow to the pelvis. I actually just did a reel on this today that like Viagra was FDA approved, expedited FDA approved. Less than 6 month approval, because there was no other treatment for erectile dysfunction. This was groundbreaking and they needed to get it to the people. So we got expedited FDA approval in 1998 for a blood flow drug. 27 years later, we get the black box warning off of estrogen, which is a blood flow drug. So we've been destabilizing sexual health relationships for 27 years because these people got an expedited blood flow drug. And these people had a incorrect box warning around their blood flow drug.
Wow.
For 20 years. It's crazy. That's crazy.
Crazy, right?
In 1998, we were just married, and Kate came home from residency.
That was 2002. We were first married in 1998.
Yeah, but we were in Galveston.
Yeah.
So it was 99 or 2000 or something like that. And so it was, yeah. And I remember I came into the bathroom, and I don't ever get headaches. And I had a headache, and she says, "Oh, take this," and hands me something. She's a doctor. I trust her. And I took it.
That's his first mistake.
I took it. I mean, within 20 minutes, I still had this headache, but she had given me a Viagra just to see what it would do. I was her test dummy. And I said, "Oh my gosh, what?" And she says, "I've got to go to work." Okay. All right. I'm just
That was not
standing around. That was really not very nice, but it was.
But if you have
funny.
a 30-year-old guy
So it worked.
with no erectile dysfunction and you give it to him, it is it's impressive. That's one of those ones where if you have a erection for 6 hours or more, you got to call
Yeah.
somebody. But
4 hours. Is
because
it 4 hours or is it?
I don't know.
It's 4, but
4 is
you know that,
Yeah,
like,
yeah, yeah. Well, it was a good
but
3.
it is but it was that was wrong with me, and I apologize.
Yeah.
Yeah, but it was but
Okay.
when we had these drug reps or come around, and
Yeah, yeah.
I'm like
But
gynecologist
I
thinking,
couldn't
I'm like,
believe
oh,
how fast she popped out of headache medication. She was like,
I
I
go.
was like, man, I've got a headache. Take this.
yeah, what's a blood
So,
flow pill? You know, it does actually work in the brain. You know, there's data that men who take PDE5 inhibitors have less dementia.
well, really?
I have
Yeah.
seen that and recommendations that everyone really should be taking.
Yeah. I mean, that's like in the longevity world, they're thinking like microdosing or lowest dose PDE5 inhibitor because it's a blood flow drug and
Mhm.
Wait a
and
minute.
it's
What's
not, it's
the
actually not
I'm
penis
sorry.
specific.
One of the Viagra and Cialis and those kind of
Oh,
things
okay.
are the
So
PD.
taking a microdose.
And you can use those on, like, on the clitoris, topically,
Yep.
and you can use
You
them
can take it orally too. Yeah.
orally, but not
It
a,
works in some women, but women don't. It's very interesting. You probably know this, but for the listeners, when a man gets an erection, so when you give a man blood flow, pretty strongly correlated to desire in the brain. Oh, I feel the blood flow. I've got an erection. Yes, I want to have sex. Pretty tightly connected. You can give a woman a pelvic blood flow improvement and she still might not be interested in sex. And they've done this. They've actually like given people Viagra, shown them erotic videos and be like, yeah, your blood flow went up in your pelvis, but it wasn't linked to you wanting to have sex. And so when people say Viagra doesn't work in women, it improves blood flow.
Mhm.
But that doesn't always mean a woman's interested in having sex.
That's interesting. Okay, that makes sense. Yeah, since they're connected in a man, if it happens, he's ready.
Yeah,
And
he's like, "Let's go.
it is
This
mattering.
means something to my brain. Let's go." Where she's
Right.
like, "Nah, I got some more blood flow down there. It doesn't mean I'm in the mood for sex though." Right? Like there's other things going on. Okay, so what takeaways for a midlife couple? What should we leave people with? How'd you wrap
Well,
this
we
one up?
talked about we covered most of it. We talked about being teammates. We talked about um, this is not midlife is not a phase. I mean, it's midlife, and the how do you I guess for me, if I could leave people with something, it would be how to restart intimacy if it's not there currently,
Ooh,
and
that's
and
gold, Jay.
yeah,
Hit.
and I would just start drinking. No, I would no, seriously. I anything that you can do to sort of recalibrate or reset things, it would be starting with just 10-minute talks, 20-minute talks, no phones, no anything, just connection.
even scheduled. Like, I think
Yeah,
that
yeah,
is,
yeah. Scheduled is
and
fine.
because
That's fine.
where you say, make this more of like a program that you're involved in and committed to, and say, okay, we're going to do our 10-minute Tuesday talk, and we're once a week we talk about,
That's
what
exactly right.
I think is working, what I think is what things that you would like to see in connection.
And the more specific you can be with the time, again, in scheduling it, and so many of us have to schedule with 2 jobs and kids and so forth. Yeah, that is fine. You can't just say, "Hey, let's try to do a couple of dinners together." No, it's gotta be, "We're doing it Tuesday and we're doing it Friday." And
And give a little appreciation during those. So you can have a couple of things that, like, check
Mhm.
things where you're going to give some appreciation. You're going to recognize where you think that someone has done a good job on things with
Mhm.
intimacy, like ways that
Or
you
just
think that you could feel something something you think has been done well, and maybe something that you feel like you'd like to see in the next week.
and it is so funny how at first how odd or fake or whatever it will feel.
Mhm.
But man, just do it. You can't believe how well it works. And and just to sit and I am now going to think about something nice that you've done. Let's see. It's fun. I'm not kidding. I mean, it works. And yeah, 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 yeah. And wow, it will you will feel the closeness starting to come back. And if nothing else, I mean, I don't know, if you find yourself fighting or battling or whatever, gosh, you've just peeled back the next layer though. It's great because now it's okay. Now we'll face why we are and what is going well and what is not going well. And it's amazing. I did this with the kids growing up where if you are in a good mood, it is amazing what kids will do to try to keep you there. And it works with couples also. If Kate is happy, man, if she comes home and she's singing or what, it is I find myself there was once where I just started unloading the dishwasher. It was dirty. And I was just taking it and putting stuff back in. I mean, just to make it look like I was wearing. Man, this will keep her happy. But it's funny how much you want them to stay there. And so this will get you over the hump of resentment, over the hump of why does he keep doing this, and will allow for more serious conversations of things that you want and that you need. So,
I
So
love it.
consistency of communication, just
mhm.
trying to, and even I almost think it's like journaling where it seems weird at first and then it starts flowing because it gets to be part of your practice. And the more you do it, the easier it becomes.
Yeah. I always think like too, like there's so many layers by the time midlife hits, and maybe some resentments and maybe some same things we keep having to rehash of like allow yourself to be curious about getting better at being a communicator and getting better at being a listener,
Mm,
Mhm.
mhm.
right? Like those two skills are like maybe we didn't learn everything there was to know about communicating and listening by the time we finished college. Maybe we could get better at that in midlife.
Gosh, yes. And there's so much out there now that's free, that is online, or that, now with the chat GPTs and all those things, becoming a better listener. When do I listen? When do I offer advice? When do I not? When do I, I mean, it's so much is out there, and you could do another hour just on listening. I mean, yeah, but, but
Mhm.
it's, that's for another day.
Love it. Well, thank
But
you for joining us. Head and Tails is the name of your podcast.
Heads and tails.
Heads and plural, heads
right.
and tails, multiple heads, multiple tails. We have a hydra. I love it. I hope you guys continue. I always tell
All
the
right.
brand new podcasters, keep going. Keep
Yeah.
Thank you.
going. You help
Yeah, thank
people.
you. It's
They're
been fun.
listening.
It's been
Yeah.
fun. Yeah.
That's
We
awesome.
enjoy
I think
it.
I
Hey,
think
well,
I'm gonna
thank
come over. I'm gonna come over to your podcast coming up
Yeah.
here.
that's
Might
right.
as
We got it.
well.
Yeah.
That's
So
right. That'll be fun.
listen more over at the Heads and Tails
Heads.
podcast.
Hey,
Yeah.
thanks
Yeah.
for having us.
Yeah.
This
Thank
was
you so
Yeah.
fun.
much. It's been great.
Thank you for coming on. I appreciate it.
All
All
right.
right.
Okay.
Take
Till
care.
next time.
All
Bye
right.
bye.
Bye.